morning, Madhuri. Thank you for being here today. My name is Vinisha and this is Kirtana. We will be your interviewers for today. Pleased to meet you.
Good morning, Miss Kirtana and Miss Vinisha. It is a pleasure to meet you both.
So could you tell me about yourself and briefly describe your background?
I graduated from Ames University with a diploma in dental assisting. There, I enrolled in a medical coding elective course. I worked as an intern at D-Smile Dental Clinic, where I took x-rays, worked chairside with the dentists, entered data into the practice management software, and answered phones in addition to shadowing a dental assistant for 4 weeks. I have used a variety of dental office software such as Denticon for coding for Medicare and also Medicaid. Since secondary school, I have used Microsoft Office software, including Word and Excel. You said in your job offering that administrative duties would be required. I see this as an additional opportunity to learn about the practice's operational side and interact with patients. I have prior experience managing phone calls and setting up appointments by working at the front desk.
What type of work environment do you prefer, Madhuri?
An adaptable work atmosphere is what I'm looking for. An adaptable work environment is an environment where we can work quickly when necessary and be prepared for whatever obstacles we must face. However, we can also work slowly when things are going well, recognizing business trends and adapting as necessary. An adaptable work environment will motivate me as a person to pick up on adaptability skills such as communication, teamwork, and organizational skills. Adaptability includes other communication techniques such as nonverbal communication and active listening. Practicing active listening demonstrates focus and readiness to alter course, and honing my nonverbal communication abilities can aid me in navigating shifts in team dynamics or professional relationships. To be able to adjust to various personalities and workplace dynamics, teamwork skills are crucial. My coworkers may have a variety of knowledge, experiences, and backgrounds. How adaptable I am in a team setting may be positively impacted by my capacity to work with varied teams of people and manage conflict, divergent viewpoints, and other dynamics that may arise. To improve my adaptation abilities, I may need to have strong organizational skills, which might comprise a variety of various characteristics. In order to be more ready for any operational changes at work, it is a good idea to keep my workspace organized, which includes paperwork, digital data, and other areas of my profession.
So how do you deal with pressure or stressful situations?
One stressful situation would be when a patient is being uncooperative. Patients may experience a range of emotions when going to the dentist. They could be frightened, in which case I make sure to address all their concerns and reassure them that we will take all necessary measures to ensure their comfort. If a patient knows what will happen if they forego a necessary surgery, they may become more cooperative. I prefer to use pictures to demonstrate unfavorable effects. I must maintain my composure around irate patients so that their reaction does not get worse. I have discovered it works best to take them to an empty conference room with the dentist so that they can explain why they are unhappy in detail and we can try to sort things out. I often relish working under pressure because it inspires me to be the best I can be and take rapid, decisive action. I would try to quickly get past the initial feeling of panic, take a deep breath, and gather my thoughts to come up with the best solution if a stressful situation like scheduling issues with tardy patients, last minute appointments, and cancellations occur.
Do you prefer working independently or on a team, and why is that so?
I have worked both individually and in groups, and I have discovered that working alone allows me to concentrate far more effectively on the subject at hand. I've always been someone who requires silence and solitude to focus and work effectively. I have trouble organizing my thoughts when there is too much noise or activity going on around me. I believe that when people gather in groups of three or more, too many important variables may be overlooked. Additionally, I want to ensure that the job is done well and up to my standards if I'm going to be responsible for the work's outcome. Since everyone in the team has different work habits, viewpoints, and methods for doing things, collaboration can be difficult. The work ethic of some teams may be uneven, with some members contributing more than others. These circumstances frequently lead to conflict or misunderstanding. I have more control over my workflow and decision making when I work alone. This will help to reduce interpersonal disputes and boost productivity and job satisfaction. Because I'm in charge of organizing my responsibilities and receiving credit for my performance when I work alone, I experience more job satisfaction. I'm also more willing to take the risk on my own, and I will feel satisfied with my job when taking risks pay off.
What did you do in the last year to improve your knowledge?
I was able to increase my knowledge and comprehension of dentistry and healthcare demands by participating in webinars and conferences geared towards healthcare professionals or dental care. Meeting consultants and other healthcare experts at conferences and webinars is also a terrific idea as I was able to network and make connections with people from various departments and sectors. As I was interacting with the people there, I was able to learn how to communicate with patients and listen to their bits of advice on how salient it is to connect with coworkers to set aside time for reflection on the previous day, week, or month's worth of work. I also volunteered to work at an understaffed dental clinic, and I acquired a variety of dentistry abilities, a strong work ethic, and innovative problem solving techniques. Additionally, I worked with patients from all backgrounds to design preventative strategies that suited their requirements.
What are your salary expectations?
I want to be paid a competitive wage that is in accordance with my education and expertise. I would anticipate a pay in the region of 1,800 ringgit to 2,000 ringgit monthly based on my research and the requirements of the position as I understand them. Of course, because money is only one component of the whole compensation package, I am willing to talk about the specifics. I am very eager to find out more about the possibilities for my development and progress here.
So, before wrapping up the interview, do you have any questions for me, Miss Madhuri?
What are some of the challenges people typically face as a dental assistant?
Thank you for your question. One challenge would be inner office politics. When you enter a new dental practice, there are many aspects of your team that you are unfamiliar with. By the time you arrive, many of the workers will have been working there for a number of years, and they may already have close relationships with others in the workplace. Therefore, we usually advise keeping discussion topics light until you get to know your teammates better. In order to do this, try to avoid difficult conversations, and if disagreements arise, attempt to resolve them amicably. It is always a good idea to speak with your supervisor if you feel like you are having trouble.
So, every employment at a dental office requires communication, but being a dental assistant requires much more. So, working with every component of the dental office will be a part of your job. Collaboration between dentists, clients, dental hygienists, and other front office staff members is a component of this. Addition to that, it's crucial that you have a cheerful disposition whenever you are in the dental office. Your attitude, whether positive or negative, will propagate throughout the dentist office since you will be interacting with every part of the business.
And lastly, are you satisfied with your experience with us?
Yes, I am, and I'm looking forward to hearing from you again.
Thank you for your time, Ms. Madhuri. We will disclose the results as soon as possible. Good morning, Ms. Vinisha. Madhuri and I are going to be your interviewers for today. Nice to meet you. So, could you tell me about yourself and briefly describe your background?
My name is Vinisha Subramaniam. I just completed my degree in dental surgery. I believe I have a strong academic background, interest in research, and commitment to patient-centered care, which makes me an excellent candidate for this job. I have a solid educational foundation in the sciences, and I'm particularly interested in emerging treatments and technologies in dentistry. My experience volunteering for local health clinics and my passion for learning have prepared me for graduate level work. I'm highly motivated and a quick learner. I'm also organized and detail oriented and have excellent communication skills. These attributes have helped me excel in all my studies and can enable me to perform well and excel this job.
What type of work environment do you prefer, Miss Vinisha?
My ideal work environment is an environment that is adaptive and also fast-paced, the one that encourages commitment and communication. I am very good at working under stress and being able to juggle different things at one time. I have experienced this through my volunteering at a nursery. This post required me to multitask and complete many jobs in the day. I had to mentor children whilst completing admin work and was responsible for a class that required a lot of patience and good time management skills. Thus, I believe I am able to work under stress and am able to adapt myself to a fast moving working environment. This, of course, will continually improve as I move through dental school, but I am determined and hardworking and will ensure I gain the further skills to succeed as a dentist.
How do you deal with pressure or stressful situations?
By staying positive and using stress as a motivator, I will also accept what I can't control, understand the situation, and take some time to think about the situation I'm facing. I react to situations rather than to stress. That way, the situation is handled and doesn't become stressful. I actually work better under pressure, and I found that I enjoy working in a challenging environment. One of the best tips for how to comfort stressed patients is to simply hear them out. By taking the time to seriously listen to my patients' fears and concerns, I am telling them that I genuinely care and want to make it better. I would stay calm and listen to their concerns and will also find a way to connect with the patients. Lastly, I'll set boundaries. I'll also address the patient's concerns, and at the end of the day, I will not take anything personally.
Do you prefer working independently or on a team? And please explain why.
Thank you for the question. In my opinion, I feel both teamwork and independent work situations come with their advantages and disadvantages. One advantage to teamwork is the collaboration with diverse professionals. However, working in groups every day can take away from focus and productivity in some cases. I enjoy working by myself and as a team pretty much equally. I love taking on independent projects, but at a certain point, I want to put my head together with a team and really refine the concept. Working in a team environment allows everyone to learn from each other. This can be especially beneficial to people who have worked on the same projects for a long time. It helps them maintain their skills and stay up to date on all the latest information. Everyone in a team will think differently and come up with the different and innovative ideas. Other than that, in a team, we can discuss and come up with a very strong idea and product. Not only that, when we work in a team, the work can be done in a shorter period compared to working individually, as all of us are going to help each other.
So, what did you do in the last year to improve your knowledge?
I did a couple of things to improve my knowledge gradually, but to keep developing myself as a professional, I've asked an experienced industry expert who I've known for years through my network to be my mentor. I reached out to him last year and explained where I was in my career and the guidance I was seeking. I convinced him of my willingness to do the necessary work and really follow through. For me, this mentor or mentee relationship has already been very beneficial, where he gives me concrete tips on becoming a better professional in my field. Furthermore, he provides me with challenges for me to stretch myself professionally and personally.
And finally, Miss Vinisha, what are your salary expectations?
I'm looking for a competitive salary that reflects my qualifications and experience. Based on my research and the requirements of the role as I understand them, I would expect a salary in the range of 3 to 3.2k. Of course, I'm open to discussing the details of the entire compensation package since salary is just one factor. I'm particularly excited to learn more about the opportunities for growth and advancements here.
Do you have any questions for us?
Thank you so much. It's an honor to be given an opportunity to ask a question. Moving on, my question is, what experiences and skills do you look for in an ideal candidate?
Dentists work with people on a daily basis and therefore need to have excellent communication skills. Unsurprisingly, many people believe they do not necessarily need this skill to become medical professionals. However, if you cannot interact and communicate with your clients, you might not be able to answer their questions and meet their needs. As a result, they might be reluctant to return in the future. Even if you are an excellent dentist on a technical level, They will want to visit someone who they feel comfortable with. Aside from your patients, you'll be working with receptionists, hygienists, nurses, lab technicians, and so on, all of whom you need to be able to communicate with and have a positive relationship.
Attention to detail. A successful dentist must have the skills and techniques needed to augment the appearance, color, shape, alignment, and also the size of someone's teeth. So often this profession is referred to as an art that requires a high level of mastery and attention to detail to create a beautiful smile that the patient is happy with. Remember, you are working with people and you have to be able to meet all their needs. So dental work should always be looking natural, and your attention to small details could make all the difference here. Dentists must be detail oriented to perform their work successfully. Being a detail oriented individual will also be important when you are examining your patients, as you don't want to miss something during your treatments or diagnosis of a patient. Thank you for your time, Vinisha. We will reach out to you as soon as possible. Good morning, Miss Vinisha and Miss Madhuri.
Morning, Miss Kirtana.
Good morning. First of all, my hearty congratulations on being shortlisted for this interview. Could you tell me about yourself and describe your background in brief?
So first and foremost, thank you for giving me the opportunity to be interviewed for this dental practitioner position today. I would describe myself as a highly organized professional and caring person who understands the need to work effectively as part of the wider dental practice team. Having reading the job description before applying, I'm confident I have the necessary attributes to excel in the role. I have good attention to detail skills. I'm a fast and accurate worker. I'm good with people, which means I will be reassured with patients, and I will always prioritize patients' need and provide them with correct level of support. In addition to taking responsibility for my ongoing professional development as a dentist, I can be relied upon to follow all dental procedures and maintain a safe working environment. Moving on to my background, I was born and bred in Shalam, Selangor. I studied in SJKT Sungai during my primary school. During my early ages itself, I found my interest in extracurricular activities. I've participated in Carnatic singing competition and have won in state level. Apart from that, I was also nominated as the best performer in a scout camping when I was in primary school. Then I continued my studies in SMK Bukit Jelutong, which is just a few miles away from my house. During my high school, not only I excelled in my studies, but also I had a balance in extracurricular activities, whereby I enrolled in traditional dance and have won many medals in competitions. After completing my high school, I joined Ames University for Foundation in Science and also pursued my degree program in Bachelor in Dental Surgery as well.
Thank you for sharing some information about yourself, Miss Kirtana. The next question is, what type of work environment do you prefer?
I basically believe in good aura, so my ideal environment is one that is positive, where everyone has a clear objectives they are working towards, and where I get to use my skills and qualities to help my patients. I prefer working in an environment that encourages everyone to reach their potential, where everyone in the hospital or clinic embraces change positively.
All right, that was a great one. Now you should be aware of the burdens that a dentist will encounter in his or her daily life. So when it comes to you, how do you deal with pressure or stressful situations?
So in this context, I would like to inform that I've worked as a dental assistant in a dental clinic as a part-time job during my semester breaks, long holidays, or whenever I get the chance to. So I experienced pressure every time, as there were only few employees working in that dental clinic. On one occasion, I had to deal with more patients than usual because of a co-worker calling out sick. So I decided to create a list and prioritize care. By organizing and paying attention to detail, I was able to manage my increased workload successfully. After work, I often practice yoga so that I don't take any of the stress with me.
Do you prefer working independently or on a team, and why is that so?
I thrive while working as a part of a team because of my ability to adapt. I find that working on a team allows for the best outcomes for patients, Everyone has a different way of looking at a problem, and multiple perspectives can bring about creative solutions to issues. Also, working on a team motivates me because I enjoy celebrating the success of others. On the other hand, I also feel comfortable and confident in my abilities to work alone as well when assessing and caring for my patients. Likewise, I prefer to work as part of a close-knit team that values support, cooperation, and learning from each other. There are countless scenarios that come up when dealing with patients in which having a solid team at your side is not just a preference but a necessity. So, putting in the time and effort every single shift to build and reinforce that team is a huge priority for me because it can literally be a matter of life for our patients.
Miss Kirtana, what did you do in the last year to improve your knowledge?
First and foremost, I practice some mirror skills. Learning how to use a dental mirror and explorer is a basic yet crucial component of dentistry. It is essential for performing patient exams and gaining proficiency with an inverted mirror, which is extremely important when you are using high-speed handpieces. So building mirror skills takes persistence and also patience, and good methods can be huge help. Furthermore, I shadowed a dentist. Shadowing not only helped me to learn about the practical aspects of being a dentist, it is also a great way to get tips for how to practice hand skills using models. I shadowed one of my dad's friends who was also a dentist, so this allowed me to observe and even practice waxing on models. Last but not the least, I took advantage of professional development opportunities. Professional development opportunities helped me hone my competencies through a variety of methods. And finally, I attended professional conferences, took part in some research studies, and took workshops to build on my existing foundation of skills. In addition, these opportunities allowed me to gain insight from external sources and establish credibility in the dentistry field.
That was good, Miss Kirtana. Now, regarding our job, what are your salary expectations?
This is a complex one. Okay, let me put it this way. The reason behind my presence here is the promising job. My wage criteria are flexible, but in the area that I think brings importance to my candidacy, I have considerable experience. I look forward to exploring in more depth what my roles at this dental clinic will be. The job climate here is distinct from what I've seen in the past. Money is definitely a significant factor, but settling here as well is the primary for me. The double quick I acclimate to this ambient, the better it would be for me. Until besides it, would be discourteous to the job position if I anywise guess any measure.
Well done, Miss Kirtana. Now, do you have any questions for us?
Yes, I do, Miss Vinisha. What is your overtime policy, and are there any on-call requirements?
Thank you for your question. I will answer your question regarding the overtime policy in our clinic. Most dental practitioners do get paid overtime. They are entitled to 1.5 times their regular rate of pay for every work day worked past 40 hours in a 7-day period. However, some dental practitioners who are considered exempt employees, these dental practitioners are generally not entitled to overtime pay, no matter how many hours they work in a week. That determination is done on a case-by-case basis. This is based on an analysis of their responsibilities at the practice. For example, is the office manager an individual who is intimately familiar with the practice financials? Do they have hiring and firing capabilities and are actively involved in practice operations? So, if so, they likely fit into the exception category and do not have to be paid overtime. Thank you.
Regarding the on-call requirements, on-call or standby time is treated as paid work time, sifting through a number of requirements. The first involves whether the time is spent predominantly for the employer's benefits or for the employees. If the time spent is for the employer's benefits, then the time is considered compensable. So we do consider some factors in this context. Firstly, the degree to which the employee is free to engage in personal activities. If the employees can engage in activities that they normally do while not on call, it is likely that the time spent on call is not compensable. Secondly, is the geographical limitations associated with the on call time. The fewer geographical restrictions, the more likely it is that the on call time is not compensable. Thirdly, is the number of calls and the time frequency of the calls. The fixed time limits for response. The less you restrict the response time, the more likely it is that the on call time is not compensable. Lastly, is the restrictiveness of the employer's on call requirements. For example, any staff member who accepts an on call assignment must remain within a reasonable distance from the office or cannot consume alcohol because he or she has to be unimpaired and able to work at any time. If the conditions are considered too restrictive, then the time spent on call will be compensable.
Well, I hope we have cleared your inquiries in detail. Thank you for your time.
Whilst I appreciate you are interviewing other candidates, I genuinely want this job, and I believe that I'm the right person for this position, and I also believe that I could contribute for a long time in the future. Thank you for your time.